Hello everyone, my name's Dan. I'm one of the exercise instructors at Scunthorpe Hospital. In a previous video we looked at plyometric exercises and the basics of plyometric exercise. Today we're going to look at some more advanced plyometric exercises, things that will be more specific to your end stage rehabilitation, specific to sports return and high intensity activity. All that we would need for this activity is a step. Ideally, you can do it without a step anyway, but if you can use a step, that would be really good. The first thing we can focus on is coming up onto that elevated surface. We bring the arms out to the side, one leg forward. Just as we drop, we try to stick and control that landing. Once you can master that technique of really controlling that landing in a nice cushioned position, we can start one side of the step using the arms, hopping up, and then again controlling and sticking that landing. If that feels okay, again another progression for you is to bring in what we call unilateral exercise, which is where we focus on a single leg landing or single leg power exercise. We can start on the step, one leg out again, arms up to the side, dropping down into that jump, and then controlling that landing with a nice cushioned knee, nice cushioned hip. In that position, everything is down in a nice straight line. I'll show you that one more time, landing on the other leg. Often when we do plyometric exercise, we can get a little bit stuck in terms of our progressions. And one major reason for that is because of our confidence. When it comes to things like hurdles that we've got just here, it can be quite difficult to push yourself to try and clear those hurdles. Using a hurdle along with the step is a nice progression. Starting in exactly the same position, everything that we've just done before, with the arms out to the side, one leg out in front. We're going to drop down, and it just means that we have to be that little bit more powerful this time to try and create as much height to clear the hurdle and stick the landing. One leg in front, arms out to the side. Hello everyone, my name's Dan. I'm one of the exercise instructors at Scunthorpe Hospital. Having explored some plyometric exercises, you may be in a position where you need to progress that even further and looking at returning to different hobbies and different sports. One of the movements or skills that's involved in many sports and activities is a deceleration, which is essentially the opposite of an acceleration, where you're trying to slow the body down in the most efficient way possible. I've set out some cones on the floor which gives me a zone to try and slow down in. It doesn't matter how fast I approach this zone. I can jog, I can sprint. It depends on your level at that time. Today I'll just jog up to the zone. And all I've done here is try to lower my centre of mass, centre of gravity, down into this nice cushioned position, cushioning with the ankles, knees and hips, getting all of these thigh and hip muscles involved to cushion that position. It's a really important thing to practice, just to condition those muscles into those intense sport-specific movements that are required for that return to sport and activity.
Hello, my name's Ciaron. I am one of the exercise instructors here at Scunthorpe Hospital. Moving on from plyometrics in terms of equipment, we're going to look at some plyometric movements that you can do with just body weight. And again, these are progressions compared to previous videos with my colleague Dan. which would just look at kind of plyometrics, but perhaps in more of a smaller area. This one's going to involve lots of movement, both in terms of linear, so in a straight line, but then also widening the angles. And we're trying to sort of replicate perhaps movements that you bring in, kind of that reactive change of direction, that force absorption as well. So the first one we're going to do is looking at a linear bound, where I'm going to alternate bounding one leg after the other, but keeping myself in a straight line. So for example, standing on one leg and then pressing forward, absorbing onto the other leg, and so on. And notice how when I am going forward, as I'm landing, I'm bending my knee, I'm taking my knee over my toes, I'm absorbing the impact, putting weight through the leg. If we are doing this type of drill and we land a bit stiff, it's going to have a knock-on effect for the rest of the body. We're going to start being a bit out of sync, our weight being distributed in lots of different ways. So really trying to hit home, weight going over the front knee, and so on. So then the second part of that, the progression would be widening the angle. So this time we're going to stand on our left foot and create a diagonal bound and land on our right foot. And then the same onto the left, right, and so on. So then there's more angles involved, more force being generated, and it's just again a progression. If you think about sportsmen, footballers, rugby players, even tennis players, that ability to absorb and then push off into another direction as part of their play, and it is a skill that does need practice, because if you've been out of the game for a long time, had extensive rehab through physiotherapy and exercise therapy, when it comes to those real life scenarios, if you've practiced in a controlled setting, when you go into that real life scenario, touch wood, it should feel pretty comfortable for you. Having practiced a bit of absorption and also changing the angles, we're now going to bring in a small series of obstacles, and we're going to look at different planes of movement when it comes to jumping. So for example, we've got frontal plane and sagittal planes of movement in this first drill. So jumping forwards, but then also jumping sideways. And then in the next segment, I'm going to introduce you to the transverse plane, so that ability to then rotate and change direction as part of your moving mechanics. So here I've got 2 hurdles that I've just set up for a real simple drill. So what we're going to do, feet behind the first one. And again, remember, when we're jumping, we're looking to cushion the blow. We're looking to absorb a little bit. So we can either do a jump and then a second jump, where we've got that little pause between our movements, and we're learning that force absorption of being able to bend the knees and put some weight through. Alternate, what we can do is a much quicker, much sharper jump. So we're like so, more dynamic, more reactive, and again, stepping up that intensity. Having looked at those planes of movement, jumping forward, jumping sideways, but still facing forward, we're now going to introduce that component of rotation. Now, if you're part of a rehab program, it's advisable that you speak to your physiotherapist or your exercise instructor before you start commencing pivoting actions, change of direction, particularly at falls, because having had surgery or perhaps had long periods of rehab, sudden forces that are going to go through the knee could create you a little bit of a problem. So it's always important you seek guidance from your clinician before you start introducing these types of movement. So with the same setup as what I did in the last drill, what's going to happen is I'm going to jump forward, but then in the same plane of movement, I'm going to jump and rotate. So I'll be facing this way at the end of the sequence. So again, nice and controlled. Sharpness in terms of absorption by production. If you feel that you're not quite at that level, of course, break it down. So do your jump, reset yourself, and then jump and turn in a second movement. You should always be pacing yourself, should always be grading yourself in terms of your intensity, and also feedback on how the body responds. If it's a knee problem, does the knee feel okay? If it's an ankle problem, is the ankle able to tolerate these forces?